Thank you.
I'm sorry, I wasn't paying attention.
Thank you, everybody, for inviting me. Am I too loud?
No.
Okay. Well, I appreciate the invitation to come out and talk to you about covering health stories. And as I was sharing with Judy earlier, I kind of feel your pain a little bit. As a child, I had asthma pretty bad. I haven't had an asthma attack for, I would call it an attack, maybe in the past probably 10 years since I've been in Richmond. I don't know if the air is better here or not. I grew up in Norfolk, then lived in Nashville. And I guess I think part of the problem, or part of the reason I had it so bad growing up was, I think was that it was an older house, it's very dusty, and I think that was one of the reasons I had asthma attacks, so I kind of know what it feels like not to be able to breathe. It's sort of like, feel like, okay, my lungs are going to explode if I can get a breath. So feel your pain a little bit. Anyway, I go through this. I just start off with an outline of what I'll talk about, the Richmond Times-Dispatch. I'll talk a little bit about the newspaper and the newsroom organization. I'll talk a little bit briefly about myself. You have that in front of you. And spend hopefully most of the time on health stories. Many of you may want to contact the paper and, try to get us to cover something you're interested in or something that you feel like you should be writing about. How do you go about doing that? And I'll leave it in for questions. Richmond Times-Dispatch, the main daily newspaper here. The main office is at 300 East Franklin Street. The printing presses are in Hanover County, production plant. Richmond Times-Dispatch is formerly owned by Media General, purchased along with other Media General newspapers by BH Media Group, I guess a little more than a year ago. And this is just a graphic of Berkshire Hathaway Company is the overall company. And those are some of the other papers that are now part of BH Media Group. And you see, I think the Midlothian local, or Mechanicsville local, Richmond.com website, Charlottesville Daily Progress, Powhatan Today. A lot of times if you see those papers, you get those papers, you get them locally, you'll see our stories from Richmond Times-Dispatch and those papers as well. Sometimes we'll run stories from those papers as well. Newspaper organization, the publisher, who is Tom Silvestri, is at the top of the food chain in terms of the Richmond Times-Dispatch. And then all these other people report to Tom: the newsroom, business, production, distribution, and the editorial opinion letters to the editor. And I'd like to point that out, because a lot of people think the newsroom and the letters to the editor are almost one and the same, but two totally different departments. So when you have a letter to the editor, you need to make sure it goes to them. But if you have a concern about a story, you need to take it to the newsroom. A lot of times people will send me letters about a story. And I said, well, there's not a whole lot I can do with it, but I can send it, if you want it published in the paper, I'll send it to the letters to the editor's department to see if they would consider it for publication. And sometimes I get story ideas out of the letters to the editor, so kind of works both ways. And if you look at the newsroom organization, you will see that there's a long list of, at least 2 or 3 levels of people above me. So a lot of times people kind of call you and they think the reporter is the person who decides everything about what that story is in the paper, and that's not necessarily so. We have an editor over the newsroom. His name is Danny Finnegan. We have a senior editor. Her name is Paige Mudd. And you have all these other different department section editors. You have a features editor, we have a business editor, the sports editor, photography editor, and metro editor. I work for the features editor, but I also write for the business editor and the metro editor. And I think that's pretty much throughout. Most of us write for more than one editor or one section. So see my line in other areas of the paper is, you know, just what we do. We used to have a lot larger staff, maybe 10 years ago, before newspapers started really laying people off. So we are all called upon to multitask and to know a lot more than we used to have to know. And as you see, reporters, columnists, photographers, and graphic artists, they all sort of report to all these different people. And there's nothing to say that I won't have an interaction with the senior editor directly or the editor directly for a story, because that can happen as well. And that's just, again, I didn't mention on that other chart, we do now have, or most news media have a large multimedia online presence. And I'm not quite sure, I know they report to the senior editor, but I know there's another editor in between them. I'm not quite sure what her title is. I guess why it's important to know how the paper is organized. As I mentioned earlier, reporters don't necessarily have the final say of where a story is placed, the headline. We definitely do not write the headlines, or even whether or not to pursue a story, because people will contact me and say, I've got this great story, and I might agree it's a decent story, but editors sometimes have other priorities. So maybe what I want to write this story, I also have to do these other stories. It's a matter of managing time. So I may not get to the story I want to do as fast as I want to do it while I'm pursuing other stories. In the last couple of weeks, with all the stuff with healthcare and Obamacare, some stories I had been working on, so I had to put them aside because, of course, the editors want to cover this story. They want to know what's happening. Excuse me. They want to know what's happening with that. So some other stories I had been working on pretty much had to say, well, I'll get back to them. And they weren't pressing, daily stories, so they can wait. Excuse me. And we have news meetings at 10 o'clock in the morning and 3:45 p.m. to decide the page one in the section front story. So when you pick up the paper tomorrow morning, those stories that are on the front have been decided usually by the group that meets at 3:45 p.m. It's usually attended by editors and outside guests for some time in life. There are other standing meetings throughout the week to decide Sunday stories and projects. I guess if you have questions about who to call, every day in the paper on A4 is a list of who the editors and their phone numbers. So if you have questions, you see a story, or every story, particularly a staff written story, has the person's phone number under the story and email. You can always directly contact them if you have a question or concern about a story. And believe me, people do it all the time. So I guess, thank you. Thank you. I get emails all the time, and we are told, we are encouraged to respond to all emails and all telephone calls and all questions as promptly as possible, just as a matter of good customer service. So like I said, and if you have questions about the editorial content in terms of the opinion and editorial pages, there are separate people to call. And then if you see there, it says contact us, letters to the editor. And you can see it's kind of small, but it's on the editorial page, a little block at the bottom. You can also go on the web and see there's a contact us. It lists the newsroom, the leaders, the senior leadership, and all phone numbers. And if you can click on another section on that site, we have everybody's pictures, phone numbers, and a brief bio about them. Everybody who works at the paper or who works at the newsroom.
Wait a minute.
Mm-hmm.
That is so cool if you haven't been on the web to see the paper.
Mm-hmm.
Oh my gosh. I could not believe it.
Which one?
I just went on because I wanted to post a announcement, and it was just really cool. I was like, oh, so this is what all the hype is about.
Yeah, and everybody, anything you have, you get a lot of, because the paper is shrinking. It's getting a little, we actually added some sections back from last time. Prior to that, the papers were losing pages.
The
So-
newspaper paper is the best, of course.
Yes,
But-
definitely. But sometimes, I mean, especially last minute stuff, because I do get support group meetings and other things that we only run, like health notes, we run that calendar on Mondays. And if you miss the deadline, it's too late, but you can always go and post it online yourself. You have to establish an account, but if you're gonna keep doing it, to be an ongoing thing, you're gonna post your events, you can go and do it yourself. And we also welcome them for the print section of the paper. Now, this let me talk a little bit about health reporting because it's very broad and it's, I'm not sure how to capsulize health reporting because it is so broad. And I look at it from the standpoint of the business of healthcare reporting, which sort of looks at hospitals, competition, drug costs, insurance companies, and medical devices. Then there's the whole policy part of covering healthcare, you know, which looks at Obamacare, legislation, the fighting over, you know, whether to defund it or is it making people get kicked off their insurance plans, regulation, Medicaid expansion, Medicare coverage. Those are all, can be all policy stories. And then there's the medicine part of covering health, which is, you know, treatments, breakthroughs, research, Dr. Oz kind of consumer health sorts of things. Then there's the fitness and wellness component of health reporting. We actually have a fitness columnist, Maria Howard, she works at the YMCA, teaches group exercise classes. She writes a weekly or bi-weekly column that runs in our Sunday prayer section. And then there's the whole consumer part of health reporting, which can be things like nutrition. And we have Mary Jo Sawyer, who writes a nutrition column, and she's a licensed registered dietitian, or she's a registered dietitian. We have a pharmacy column, which is very popular by Terry and Joe Grady, the People's Pharmacy. We run a columnist who writes specifically about senior issues. And we also run a parenting column by, I can't think of Dr. Rosamond, who has been quite controversial. So health reporting is broad. It can be just about any topic, I'm sure, has a health component, and you can make a health story out of it. We actually added back a health section last month, so we actually have more room to write health stories. I will say, I haven't written any stories for the section yet. I've written a column, haven't been doing another assignment recently, so haven't had time to come. But I have a whole list of stories. I guess one other thing, regulatory type stories.